Fukushima, presented by Elizabeth Flores, Salik Hatcher, Rohan Garg, and Sloan Whitman.
The objectives of this presentation are to analyze the events leading up to, during, and after the Fukushima power plant accident, to understand the causes and implications on public, environmental, and occupational health, and last, to strategize an action plan and message to combat the negative health outcomes from the time of the event to today.
For this discussion, we will be focusing on the following topics: the cause of the Fukushima disaster, its impacts on the population and environment, environmental justice and social equity issues, the problems, the actions taken, and what are the effects 10 years later. We will also be offering you information about solutions and our global message or takeaway from this disaster.
This disaster began on March 11th, 2011, and some of the causes that led up to the Fukushima power plant incident started with a 0.9 earthquake at 2:45 p.m. on March 11th in Tohoku, Japan, and the range from that is about 400 kilometers north-south to 200 kilometers east-west. What happened next was unprecedented, and it was a tsunami that was 14 meters high. The tsunami triggered by the earthquake caused units 1, 2, and 3 at the Fukushima power plant to react, resulting in them to be disabled. This caused a nuclear disaster at the power plant where water was injected into the cores 1, 2, and 3 as a cooling mechanism. However, it failed. This caused major problems at the nuclear power plant, and by May 2011, it is reported that over 24,000 people were either dead or missing. This slide shows a map of Japan, which can be a great model to see the distance from the earthquake center and the Fukushima power plant, as well as some of the cities that were impacted. We know that the earthquake's fault ranged from 200 kilometers by 400 kilometers. And judging by this map, we can infer that this earthquake hit multiple locations across Japan and contributed to a lot of damage along the eastern region of Japan. In an article by Mimura and others, it states that Japan has been a long and repeatedly suffering place that has earthquakes and tsunamis, as 70% of its national land is occupied by mountainous areas, population assets, industrial activities, and infrastructures are concentrated in the narrow, low-lying coastal areas. And Japan has made long efforts to prevent damage from natural hazards, such as earthquakes or tsunamis, but still there's a significant impact that this earthquake and tsunami had on Japan at the time. When we look at the Bradford Hill causation criteria, we can see that there is a strong association between the earthquake and the tsunami as it impacted the power plant. We can also look at the replication of the findings when we look at the disaster that happened in Chernobyl in Russia. And last, it is highly plausible that the causation was a result from the earthquake and the tsunami.
The Fukushima tsunami and nuclear disaster had immediate impacts revolved around public health safety. Individuals had to be evacuated and relocated as a result of damaged infrastructure and facilities. The evacuation involved a total of over 400,000 individuals, and of those, 1,700 deaths are attributable to stress, fatigue, and the hardship of living as evacuees. People were given temporary housing, which gave rise to increases of non-communicable diseases such as diabetes and poor mental health. This, along with a lack of access to health care due to poor infrastructure, further contributed to the overall deterioration of health. Among those most susceptible were the elderly, as their health states are reliant on solid infrastructure and amenities to include continuous medical support and services. Some of the long-term effects of the Fukushima disaster led to a wide range of social, economic, and public health consequences. One area in which Fukushima was economically impacted was its fishing industry. Some countries, like South Korea, have retained a ban on imports of seafood from the Fukushima region that was imposed shortly after the nuclear disaster. As mentioned in the previous slide, the disaster also increased mortality rates among the elderly, who suffered negative health effects as a result of being placed into temporary housing shortly after the disaster. Other long-term impacts observed from the Fukushima disaster pertain to the public health consequences of high radiation levels found in the surrounding environment. Fukushima's food, soil, and water are still contaminated with a large amount of radioactive particles, which is why there's a lot of discussion and debate about what to do with the contaminated water. Also, the exposure to high radiation levels has led to concern about an increased risk of cancer within the Fukushima population. Currently, Fukushima is still suffering from the effects of the nuclear disaster through unpredictable radioactivity that continues to affect primary food sources and local economic gains that the region once experienced in the fishing industry. Since the disaster, the Fukushima nuclear power plant has been slowly releasing radioactive water into the ocean as a result of broken pipes that are slowly leaking out water from containment tanks. It has been estimated that 80% of the released radiation has been deposited into the ocean, while the other 20% has mostly dispersed within a 50-kilometer radius to the northwest of the power plant. The contaminated water, which is largely concentrated in the Pacific Ocean, is affecting marine life and the fishing industry, as there continues to be concerns over the safety of seafood consumption. These concerns have been confirmed by evidence of the presence of high radioactive levels that have been found in flounder and tuna caught close to the plant. Other signs of contamination have been found in some of the region's food, water supply, and local farmland. Previous incidents involving radioactivity have demonstrated an increased risk for development of thyroid cancer, like those observed at Chernobyl and Hiroshima. Unfortunately, the Fukushima nuclear disaster is so current that not enough time has passed to fully observe the latent effects of radiation exposure on this population. So in order to predict the increased cancer risk for Fukushima's population, scientists will have to rely on research collected from the Chernobyl accident and Hiroshima's survivors of the atomic bomb. The dose of radiation that is needed to cause thyroid cancer must reach or exceed 50 millisieverts. Thus far, there have not been any detected radiation levels greater than 50 millisieverts observed among study samples of Fukushima's children. In comparison to the other nuclear events, Fukushima's radiation levels are lower than Chernobyl and Hiroshima's, which was greater than 100 millisieverts. Some experts claim that there is not enough strong evidence in support of a causal relationship of radiation exposure and thyroid cancer for Fukushima's population, but more good epidemiological studies are still needed. At the time of the incidents, infants, children, and adolescents would have been among those most susceptible to the impacts caused by radiation exposure. As such, thyroid screenings are being done on younger age groups in hopes of detecting cancer in the earlier, more treatable stages for Fukushima's population.
After looking at the health impacts from the radiation incident in Fukushima, we will now consider the perceptions of safety and the susceptibility of danger from the radiation exposures. Perceptions of safety were skewed between public officials and the citizens near the areas of radiation exposure. Public officials included the government, scientists, TEPCO operators, media, and International Atomic Agency. These groups were considered the atomic circle because they continually mentioned how citizens were safe despite the known levels of radiation in the environment, food, and water the community relied on. While these officials continued using safety myths and increased acceptable radiation levels, citizens had strong distrust in these officials. Citizens formed their own pact in understanding the now changed environment they lived in due to the Fukushima radiation incident. SafeCast is a tool created by scientists and used by citizens to measure radioactive material and everyday items such as food, water, air, and other objects. The overall goal of this tool was to increase transparency for worried community members, something that public officials fail to provide at such vulnerable times. SafeCast continues to be used internationally and informs future policy to continue the movement of citizen science. Geographically, rural nuclear towns are areas in close proximity to the nuclear plant. They are known to have issues of distributional equity, which is the disproportional release of nuclear toxins in farm areas compared to central cities. When community members of these nuclear towns voice their concerns, there is a lack of procedural equity. Civic discussions often ignore the needs of rural communities that live near nuclear plants, especially when it comes to the concerns of safety. Safety myths may be used to go against the experiences and perceptions of hazards that citizens or rural areas deal with. Socially, the atomic circle are public officials that hold the power in making political decisions that impact communities. They are often elite and work together to provide information to the community. There is a difference in decision power between those in the atomic circle and those that live in rural areas exposed to nuclear waste. The elite are furthest away from the health issues and hazards posed by nuclear waste that rural communities are continually exposed to.
What were some of the actions that were taken by TEPCO, which owned the Fukushima Daiichi nuclear power plant, and the Japanese government in order to reduce the amount of radioactive contamination? So the immediate action that was taken was just evacuating. This was done by volunteers from the community as well as workers on the facility. Workers on the facility were trying to get people out of the facility, and community workers or volunteers were trying to get people in the community as far away as possible. So this was kind of a um, evacuate as we learn more information. So on March 11th at 8:50 p.m. on in 2011, there was a 2 kilometer radius where you needed to evacuate from. Then an hour later, this changed to 3 to 10 kilometers. Uh, 4 days later, on March 15th, this ended up being 20 to 30 kilometers away. And on April 21st, there was a 20-kilometer no-go zone. So basically, anywhere in this 20-kilometer radius, you were at risk of exposing yourself to very high radiation levels. One of the bigger things that were done was storage, disposal, and decontamination. So storage, they created these containers where they would pump contaminated water into, and then they would run it through a treatment process, which would try to rid the water as much as possible of radioactive materials. And then they were sent into disposal, but as of right now, there's only two ways that you can really dispose radioactive material, which is either in the air or in the water. So they're just being stored right now in dry containers. Another thing that they needed to reduce was the amount of radiation fallout via air and rain. So in order to do this, they constructed 109 concrete panels on top of these reactors. They had to do this in order to stop the radiation that was spewing into the air due to the effect of so many hydrogen blasts, which opened up the reactor cores. TEPCO also sprayed resin polymer, which would help with reducing the amount of radiation fallout via air and rain. And then they also created an ice wall underground in order to divert or reduce the amount of underground well water which would flow into this area. It has been over 10 years since the Fukushima Daiichi nuclear power plant meltdown. So how has cleanup gone over the last 10 years? So cleanup has actually slowed down quite drastically. In 2011, they were getting rid of or removing 470 cubic meters of contaminated water daily. As of 2021, this has gone down to around 150 to 220 cubic meters per day. A huge problem that they're encountering when trying to get rid of this contaminated water is heavy rainfall adds a huge amount of volume to the contaminated water, which adds days and more money in trying to get rid of this contaminated water. Another thing that they're facing is that the water treatment facilities that they constructed weren't as effective as they initially thought they would be, as most of the water that comes out of the treatment process actually is way too radioactive to be let out into the environment. It has to be run through it multiple times in order to get it down to a standard that is acceptable. Labor has also halved from around 10,000 in 2011 to 5,000 now. And it is estimated to cost over $193 billion for the Japanese government in order to dismantle, decontaminate, and treat all this radioactive materials. And this accounts for over 20% of the Japanese annual budget. And they are running into space issues, so they don't have enough space to store the contaminated water, and a lot of these storage areas actually have had leaks. What can be done to prevent another Chernobyl or Fukushima Daiichi disaster? So, from some of the research I did, one of the more interesting things that I found was storing used fuel, radioactive fuel, in dry containers. So, the Fukushima Daiichi nuclear power plant stored 97% of its spent fuel in wet storages or with water, and only 3% of the used fuel from these reactors was stored in dry containers. So, after the earthquake and subsequent tsunami, all these dry containers that were used, the 3%, none of them were harmed, broken, or led to any leaks, compared to the wet storage, which created a lot of atmospheric dispersion of radioactive materials as well as led to the hydrogen blast. Since 2011, there have been some technological advances, such as an enhanced ventilation system, which traps dangerous radioactive molecules like cesium 137 and from entering the atmosphere or the air. So this allows for less hydrogen blasts, which will then allow for increased evacuation and core stabilization if need be. Another thing is directly disposing it in an underground repository. So basically, it's like a dry container underground that is surrounded with sand, concrete, and things of that nature that will not be um, susceptible to radioactive contamination. And another thing that we could do as a society is just move away from nuclear energy. There are benefits of nuclear energy. People who advocate for nuclear energy say that it's good for the environment as there's less carbon dioxide exhaust that is put up into the atmosphere, so it helps with decreasing climate change. And it is much more potent than green or natural resource energy, such as gas and coal.
In considering the Fukushima nuclear power plant disaster, our group would like to share our main takeaway from this incident and subsequent events. Our message is for countries around the world who rely on nuclear energy sources to have a policy in place that provides instruction on emergency disaster management. This policy should outline the various mass or public communication strategies and include methods that promote transparency to ease mental and physical public health concerns and issues. This policy should also include an evidence based emergency preparedness plan to ensure proper resource allocation. Lastly, policies must seek to employ alternative methods of information dissemination to the public, which will help improve the opinions of public trust in governmental entities. Methods may entail the use of platforms like SMS messaging, credible news sources, civic engagement events, nonpartisan platforms, and the internet. Utilizing these platforms will bring about a better public response and prompt evaluation strategies.